subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us Dr. Dilip Shah. For those of you who are regular with our events, Dr. Shah has been a star performer, in fact, a singing superstar, if I would say, in our Seniors Have Talent event that we've had, I think season 3, if I remember right. Dr. Shah is a leading orthopedic surgeon based in Mumbai. With over 4 decades of experience, Dr. Shah completed his MBBS from the KEM hospital, which is the GS Medical College in way back in 1978, and an MS in Orthopaedics from the same KEM hospital and GSMC in 1980. He is a member of the World Orthopaedic Surgeons Association and the Bombay Orthopedic Society. Welcome to Health Live at Seniors Today, Dr. Shah.
Thank you very much for inviting me.
How have you been? And we, of course, have been in touch thanks to Seniors Have Talent, but how has the entire pandemic been for you?
The pandemic actually came as a stroke to me. My article came in one Gujarati newspaper as a person who has not left his house for almost 68 days. So that was the thing. जैसे कहते हैं कि कुछ भी लांघना नहीं चाहिए. So we did that way, and then I started working, and then I have been operating also, but with all precautions, all absolute precautions. And patients also have to get their RT-PCR. The relatives have to get RT-PCR done. And in the hospitals where all COVID patients are segregated from normal patients, I operate in those hospitals only.
And how do you find the situation now? We are here in Mumbai, and so are you. The government is considering easing things. It has eased already in other parts of the country. Where do you see things going right now?
We'll go one step forward and then we'll go 2 steps behind.
So before we get on to the topic for today, which is hip replacement, any advice to our readers, attendees who are there here?
Pertaining to COVID, you want to give, or in general?
That's right. COVID.
Look, it is like a vacuum and release phenomenon. So don't be like a boomerang, okay? Go very slow and steady and slowly increase your activities. And please do not forget double mask. It's absolutely mandatory. Maybe it is going to be a norm for next 1 year or so. And those who have not taken their vaccines for some reason or the other, please finish off your 2 jabs of vaccination, because that is only going to help you in future as well as right now.
1 minute, you mentioned double masking, right? So which means you wear 2 surgical masks, one N95.
No. Yes, exactly like that. One N95 is absolutely necessary. Other masks may be anything.
And would you recommend any specific type of an N95? Because there are so many of them, N95, K95.
No. We have to use N95. And besides, there are some with the filters. Filters helps you, but it is detrimental to others. So please don't be selfish. Do not use with the filters.
Great. Thank you very much, Dr. Shah. So over to you for your presentation on hip replacement. And after that, we will invite the audience to ask you questions. So if you have a question, please put them in the Q&A tab. And after Dr. Shah's presentation, we will address it to him. Over to you, Dr. Shah.
So thank you very much. And here we begin with the journey of having what should I say? Total hip replacement. So total hip arthroplasty or replacement. We call it as arthroplasty also because arthros means joint, and plasty is a kind of plastic surgery where we change the joint. And I thank seniors today who have been really promoting such healthy activities. Now, if we go into the history of hip replacement surgery, deformed and ankylosed means which are absolutely no movements in the joint. surfaces were contoured with biological material. For example, there is some fascia available, we call it fascia lata, as interpositional layer to resurface the joint and allow movements in UK and Europe in early 20th century. And if we have to really give importance to history, then in 1912, Jones used gold foil as interpositional layer. In 1923, Smith-Peterson introduced mold arthroplasty and later bakelite and celluloid derivatives, and in 1937, Vitellium implants. But father of total joint replacement surgery, here you can see Professor John Charlie. Actually, he changed the whole outcome of that, and whatever dictates he had given, they are still true till today. A British orthopedic surgeon, pioneer of modern hip replacement arthroplasty, and developed the technique of total hip arthroplasties in 1960. You would ask me why anybody would require a joint replacement. So for example, you have rheumatoid arthritis. You can see here where the fingers become crooked and the patient has many, many joints involved, or right from childhood, which is known as juvenile rheumatoid arthritis, or a condition like this, ankylosing spondylitis. You can see it is bamboo spine, and all the joints which are having movements, they get no movement at all and they become one piece. Or it could be avascular necrosis, a slipped capital femoral epiphysis. That means the growing end of the head of femur starts slipping. They are found in effeminate kind of children who look like females. Actually, they have very big buttocks also. So they are the condition. There is another condition, congenital hip dislocation. If you can see here, Marilyn Monroe, we kind of find her walk to be very wonderful. It was actually because of her both the hips remained dislocated and she never took treatment for that. Or it could be a dysplasia, means the growing end of femur gets affected in the childhood, which is known as Perthes disease. Or in elderly, more so in the white skin people, Paget's disease, where the hip gets eroded. Or it could be following a fracture. You can see here, this is the femur bone and this gets fractured. Or it could be a bleeding disorder like hemophilia. So indications for osteonecrosis, that is the blood supply to the head of femur. This is the femur bone, and because of some reason, the blood supply to the head of femur is temporarily disconnected. It could be idiopathic. We generally say that when the doctor is idiot and patient is pathetic, in fact, there is no cause for it. Okay, so we call it as idiopathic. Or as I told you, the slipped capital femoral epiphysis, or as I told you, the blood dyscrasias, kidney disease, or there are some patients, for some reason, they are given steroids, prednisolone, and uncontrolled alcoholism also. If you have more than required dosage of alcohol every day, it can happen. Or in the divers, it is known as Casen's disease. If you go underwater below some particular meters, it causes. Or some glycogen storage disease. It could be because of fracture which has been treated and it does not unite. You need for that. And it could be not uniting the fracture, or as a primary thing. When you fall down, if your age is above 65 or so, we would replace the joint and give you a wonderful life. Or it could be because of infection, or in our country, which is common, is TB, tuberculosis. So it becomes like a mortar and pestle or various other types. But you cannot immediately do in tuberculosis. You have to wait for 4 to 5 years till it's dormant, and then only you do it. Or the hip joint has no movement at all, or you have tried to do some surgery for fracture which has failed, and then you need a joint replacement. Or for TB earlier, people used to do, or for some other reason, the head and neck of femur was being chopped off. So the pelvis going left with only the acetabulum, the cup, and only some part of femur. So the head was missing. So there we can put the head. Or there are some situations known as resurfacing. I'll come to that. This is resurfacing. which was started in Birmingham but not done anymore. Or it could be some tumor, some cancerous situation in hip where we have to chop off upper part of femur and then we replace the joint. Or achondroplasia, where there are some jesters like we have in circus, the jokers, who are dwarfs, so their joint also get affected, so they may need the
Your
joint
hip
replacement.
consists of two main
I will
parts
show
that
you
fit
how we do
together
it.
like a
There are
ball
two
and
main
socket.
parts
The
in
femoral head at the
femoral
top of the leg
head,
and the
and here this you
acetabulum
have
in your
acetabulum.
pelvis.
Acetabulum
A
is the
total
cup.
hip replacement is usually done when severe damage from arthritis or injury has made it difficult to perform daily activities.
So when your daily activities cannot be performed
During
well,
the procedure, the femoral
we
head and
replace.
acetabulum are replaced with artificial components called prostheses. An artificial hip prosthesis consists of a cup called the acetabular component and a metal stem called the femoral component. Your surgeon will begin by making an incision overlying your hip, separating the muscles and ligaments to expose the joint capsule. After incising the capsule, your surgeon will dislocate the femoral head from the acetabulum. He or she will remove any damaged cartilage or bone in the acetabulum, reshape the acetabular socket, and secure the acetabular prosthesis in place using special cement or screws. Turning next to the femur, your surgeon will remove the femoral head, shape the remaining femur to fit the prosthetic stem, and secure the femoral component using cement or other techniques. Once both components are firmly in place, your surgeon will slide the prosthetic femoral head into its acetabular counterpart, test the movement of your new hip joint, and verify that it is properly positioned with an X-ray. Your surgeon will then close the joint capsule, repair the muscles, place a drain in your hip to remove excess fluid, and close the incision with stitches or staples.
Now, the components and design, if you want to really understand them, these are some technical things. So we have the femoral component, which is going into the femur bone. And number two is the acetabular component. Now, what is our goal when we do total hip replacement? I do not sell total hip replacement. The patient has to ask for it, should cry and beg for it, please. If we do it, unindicated cases, it's crime. So biomechanically, it is sound, stable hip joint by restoration of normal center of rotation of the femoral head. And then there are three different angles which you should keep in mind, that the bone femur is in three different planes. One, it is vertical plane. Another one is the horizontal offset. And third is compared to the shaft, the head is twisted. So that is anteversion offset. So we try to bring them together and then we get a perfect hip joint. And usually it gives you a good rotating component in the femoral canal. Normal femur is 10 to 5 degrees anteverted. It is rotated like this. And in press fit fixation is used modular femoral component issued. Am I audible?
Yes, you are. Yes, you are very, very
Okay, these are some of the femoral components we have here. And then we try to improve, because by study we have seen this is known as impingement. So we have to keep in mind that these are detrimental, which should not happen. Now, there are various types of joints we can do. One is cemented stem and other one is cementless stem. The cement is actually we use for human beings, which is polymethyl methacrylate and monomethyl methacrylate. They are mixed together. And then we make it a porous surface, non-porous surface, specialized custom-made stems, which are cementless. Most designs favor cobalt chromium alloy. Polymethyl methacrylate cement is the standard for femoral component fixation. The pitfalls are, it is debonding, mechanical loosening, extensive bone loss with fragmented cement. So these are the femoral components we have here. And on top, you can see we have a lot of modularity possible. So if we can mix and match. And when we do cementless, which is more biological material, is usually titanium alloy or cobalt chromium alloy. Bone ingrowth into porous metal surface requires immediate mechanical stability at the time of surgery. So you have to be very precise. And then intimate contact between the porous surface and the viable host. So surgical technique and instrumentation need to be so precise. There is no other second take, okay? So you better do it very well so that the patient is always happy. So these are some of the examples of the femoral stems. Now there are some specialized stems and prostheses we make depending upon the requirement. There could be a custom made also for tumors and all. Now let's see the acetabular components, that is the cup, which we place into this acetabulum. So it could be cemented or it could be without cement. And in some situations where it gets dislocated very often, then we use constraint type, specially custom made for that. So these are for cemented situation. You can call it plastic, but it is high density polyethylene. And then these are uncemented, where you can see the porous coating over there. And to get more stability, we fix them with the screws which go into this bone, which is known as the iliac bone. This iliac bone, we fix it with the screws. Now, constraints are absolutely necessary in repeated dislocations, or there are some patients, polio patients, or those who have deficiency in their hip muscles, or they suffer from some muscular dystrophy. So constraint is not so common, so you may just bypass what I talked. But then we have highly cross-linked polyethylene with vitamin E, which is the main component used today. There was a time when we used metal on metal bearings, which is not allowed now, and ceramic on ceramic bearing for very, very young people. So metal on metal, I said I would talk to condemn it. We don't use it anymore. Ceramic on ceramic is very nice. Alumina ceramic is used. High density, hydrophilic, smoother than the metal. Ceramic is harder than metal and more resistant to scratching. Linear wear rate is 4,000 times less than cobalt chromium alloy on polyethylene. So there could be some disadvantage, impingement between the femoral neck and rim. There could be implant malposition, stripe wear, or there could be squeaking. It used to make so much of sound that people used to feel. You will realize when you are walking on some shoes which squeak. Similarly, the hip also used to squeak. And then osteolysis, means bone also starts getting disintegrated. There is a newer variety of oxidized zirconium and ceramic metal alloy, not susceptible to chipping, flaking, or fractures. The exercises immediately after surgery are so essential that you move your feet up and down and rotate your toes and ankle. Why? Because unless you do this, there is going to be something like embolic phenomenon, and it could be taxing to your life also. Move your hip and knee joints. And exercise prescription in the later stage is you stand behind the chair, start moving one hip after the other, do these exercises well, and your rehabilitation program gets over. So there could be some complications. I cannot say that everything is good. So there could be blood collection, there could be a new bone formation, there is some kind of air bubble or fat going into your lungs, which can be fatal. It can kill somebody. Or if doctor is not very vigilant, then there could be some nerve damage also, or blood vessel damage also. And if we are not very precise in calculating, or we check out what is the length we have created now, if we have not positioned the components well, it can dislocate, or it can subluxate, fractures of the acetabulum, the cup, or trochanteric non-union. If you have cut the trochanter, there could be infection, which is 0.01% or little more, or it could be loosening and bone loss. So ultimate picture, this is after 16 years of implanting an uncemented total hip. Now, if somebody is interested, then I'll tell you about what anesthesia we give. If you want take-home message to prevent, because I feel prevention is better than cure, please don't lock the doors of washroom from inside when you are inside. Sit down on a stool or chair and take bath or shower. Don't stand and take a bath even under the shower. Keep a hand hold attached to the wall near your WC and use it while sitting down and getting up from the commode. If you find it difficult to wear your trousers in standing position, you better sit down on a chair on bed and then wear them. When you get up from bed, get on to sitting posture, stay there for around half a minute, and then stand up near the bed for 30 seconds before walking for attending to calls, especially at nights. Avoid climbing stools. If you want to get something from your upper closet or something, please, you don't do it. Ask your younger people to do it, or your servants or helpers to do it. And don't start cleaning the fans or photos which are over there, and drying clothes also. You don't try to bring them down. Use something or ask somebody else to do it. So better to have a call bell in your bedroom to call for emergency at night, and always have a dim light on in the bathroom at night. These are something which is very important, and I thank you for patient hearing. So I thank all of you who have been my listeners, as well as I thank seniors today for inviting me to give a talk on total hip replacement, because I know it is quite an advanced talk, because total hip for you to understand is difficult. But by answering your questions, I'll be highly thankful to you if you ask your questions, because why? Your question may be someone else's question also. So go ahead and ask questions.
Thank you, Dr. Shah, for an excellent presentation. I think it was very explanatory, self-explanatory, and I'm sure most of the questions that people have had have been answered. But nevertheless, we have a question from Dr. Vimal Mishra, who asks, what are the effects of COVID infection on musculoskeletal system and how do we tackle it?
Every day we find, Vimal, I thank you very much for asking this question. And as we go more and more, actually, during COVID times, you may be aware that steroid is used like, हम लोग बोलते हैं सिंग चना के माफिक use करते हैं. And steroid is the main component which gives rise to avascular necrosis. That means, if you can visualize here, this is the head of the femur and blood supply to that is cut off. And the season ball becomes a ping pong ball. And that adds to more indication for doing total joint replacement. So we have to give a preventive aspect also, like zoledronic acid or bisphosphonates. And those who have very poor quality of bone, we have to improve them later on so that they don't get fractured. The muscles also, they get fatigued, as you know. So it takes almost 3 to 6 months to recoup back. So they have to do physio.
Thank you. We have a question from, quite a few questions. We have a question from Jamie Santamaria, who says he was diagnosed with osteopenia 40 years back. At 81, informed that that he is now normal. Is this ailment reversible? Runs a lot, takes D3 on and off, and sunlight. Your response, please. Is activity at this age okay?
Oh yeah. You see, we do the DEXA scan study pertaining to your age. We compare with your age. So in one time when you were osteopenic, that means your T-score was between -2 to -2.5. Anything worse than -2.5 is known as osteoporosis, and that needs to be attacked If you don't do that, then the bone becomes almost like a scaffolding without any content. So if you have osteopenia and if you are above the age of 55, especially in women I'm talking, then you can take oral bisphosphonates, which can be once in a day, or it could be once in a week, or it could be once in a month, or intravenous infusion of zoledronic acid once in a year. But this should not be given for more than 5 years, for it can cause some atypical fractures also. Those who are minus 2.5 or worse, they can be given injection teriparatide, which is pituitary hormone, every day up to 2 years. That is the study, and now study says you can take it for more than 2 years also. And of course, calcium and vitamin D is absolutely essential.
Thank you. We have a question from Devendra Gada, who asks, Doctor, where was the hip replacement in the presentation? It was only the joint of the hips.
Let me clarify. Hip replacement is replacing two components. Okay, we have here, can you see this? Visualize, this is the cup.
Yeah.
And this is, sorry, this is the cup and this is the saucer.
Right.
So in hip replacement, we replace only this part and we replace this part. So this is how it is. We do not replace the total. Hip is made up of only two parts. One is acetabulum, saucer, and another one is the cup. To you, pelvis bone probably is coming in the way of understanding. So when you say pelvis, pelvis is total pelvis. You have this bone known as ilium, you have ischium. This replacement is needed only in cases of very bad tumors, if limb is salvageable.
Thanks. We have a question from NC Jain, who says, my age is 77. I'm diabetic, but no blood pressure. Since the last many months, I'm feeling pain from my right side hip to the knee, only when I take rest in the afternoon and in the night. What should he do?
See, basically, when you have pain which goes from hip to your thigh, I would ask a very specific question. Is it in front of the thigh or is it in the back of the thigh? If it is in the front and by movements of the hip you are getting pain, it is the hip arthritis. But if you have pain which goes from your buttocks to your thigh, knee, or may go up to the heel, then it is because of sciatica pain. There is a nerve which is known as sciatic nerve, and it could be mild slip disc which can create this nuisance for you. So we have to first and foremost clinically examine you and find out whether you have a hip problem or you have a spine problem, which can be otherwise also studied by doing x-rays, pelvis with both hips lateral, and lumbosacral spine AP and lateral, which will give you a telltale evidence what is wrong.
Thank you. We have a question from Umesh Khare. He says, I'm 75-year-old male living in Delhi. I had suffered with an acute lower back pain about 30 years back, which had made me completely immovable, and I was bedridden for about 3 to 4 months. I got relief with some therapy called megapulse therapy, given by a London returned orthopedic surgeon in Lucknow at that time, after a lot of different treatments. After that, I'm doing regular exercise and doing my regular routine, but I get a pain attack once or twice a year, mostly when I'm in the bathroom or on the wash basin, and gets bent over time over there. This takes 8 to 10 days every time to come to normal. I use a lumbar belt when in pain. I got COVID-19 in April 21 and got treated at home. After COVID, in the last 2-3 months, I'm having regular pain in my lower back, but not severe. Now, no complete relief from exercise. Is there any permanent treatment for this pain? He asks.
The backache can be treated, but we cannot abolish the pain because of that. You might be having mild slip disc at maybe L4, L5 and L5S1 level. If you do your MRI, you will be able to realize this. If it worsens, then you can do something known as EMG nerve conduction studies, which will give you a definite clue which nerve is being affected. So you can study that. As You can improve your back muscles by doing back strengthening exercises. And as and when it pains, you can take some medicines like pregabalin and improve your B12 level, methylcobalamin. These are some medicines which will help you. But if it goes beyond your tolerance, then you better get these 2 studies of MRI and EMG nerve conduction studies. And if it is really hurting you, there may be a good reason to see the indication for doing this surgery for you.
Thank you. We have a question from Mr. Jayesh Sudasama. He says, is bilateral hip replacement possible at one time? If yes, what are the difference for single hip replacement and bilateral hip replacement? What is the time period for recovery? I have diagnosed AVN and 44 years. Is it mandatory for AVN?
Yes, AVN, we have staged them into 4 stages. So if it's stage 1 to 2, maybe complete bed rest at that time may help you. Or we have something known as Furage procedure, whereby the head of the femur, this is the femur, we put in some sharp instruments and we core out, and then put bone grafts in the form of one bone called fibula, which is next to your tibia bone in your leg, and some autologous bone grafts we harvest from the iliac crest. So we harvest from here. Right. And fill up the void which has been created about and give you rest for 3 months, and maybe hopefully it will recover. In early times, we can give bisphosphonates also, which help you in improving the quality of the bone. But avascular necrosis, when it goes to stage 3 and 4, which makes you absolutely incapacitated, pain is so much, it's better to get it replaced, because hip replacement is going to last for at least 25 years. And you said your age is 45 years. Now, I can do both the hips in one sitting, but the anesthetist has to agree. Secondly, there are many factors in insurance company, because if your insurance, say for example, is of 5 lakhs, and if it goes beyond that, it's worthwhile postponing and time it in such a way 2 months prior to your renewal of the insurance. Get one hip replaced, and after 2 months, get another hip replaced after you have renewed your insurance. But if you don't care much about insurance, it's absolutely on the anesthetist as well as the patient who wants to do. From surgeon's point of view, if you do surgery, 2 surgeries, maybe we are paid 1.5. So surgeons would prefer to do it in a staggered manner.
So there's a question from Dr. Vimal Mishra on the life of a replaced joint, and does one need to do a joint replacement again?
Yes, as I told you, 20 to 25 years is good time for well done uncemented total hip. Why uncemented? Because it becomes a part of your bone. But after 25 years, the components, they start becoming loose, or the interface which we have, as I told you, ceramic on ceramic is the best one. Today, we have a possibility that ceramic on high density polyethylene is supposed to be better than that. That studies have shown in last 15 years. Metal on metal is totally no, you should not do it. So on components which have been used, how you have, the surgeon has inserted the prosthesis, and he has tried to recreate, which the God had created for you. Depends very much on that.
Right. Doctor, there's a question from Sandeep Sharma, who's very happy with your presentation, and he asks, my dad is 80 years old. Is it safe to get the operation performed? How long will it take to recover?
Sir, I didn't know what is the indication for doing his total hip replacement.
That's not mentioned at all.
So if he has been suggested by any surgeon, then first, primarily, as I told you, I don't want to sell hip replacement. The patient has to beg for it. Is he so incapacitated that he needs a total joint replacement? And if so, a physician will take overall tally, what all things are good, what is bad, will bring everything under streamlined control, and then subject him to surgery. So there comes a question what anesthesia, and I would prefer spinal epidural anesthesia so that we do not overload or create problem for the age like this. I have operated on patients around 100 years also, and they walked on next day.
Wow. Doctor, we have a question from an anonymous attendee who says that it appears that hip replacement is a surgery that only city dwellers can do, because I have a relative who's in a small town and who does not have access to a big hospital. You know, he is wondering whether if he has to come to a city like Mumbai or Pune, will he have to stay here for several months before the recovery happens?
That's a very nice question. One, after having done hip replacement, let me tell you one thing. You cannot sit down for Indian style of toilet. Even if you can sit down, I will not permit that, because my implants which I have put will not last for 20 years, okay? There is a likelihood that it is going to be overuse and abuse of that joint. So from a small town, first he should understand that he is going to use chair commode. He becomes a Western style person. He'll not sit down for having meals. He has to sit on a chair, and on table he has to have dinner. Now, today is the time even a small town person wants to do total joint replacement. There are 2-3 things bad. I don't want to condemn anything. Please, I'm just opening your eyes. One is infection, experience, quality. If you want a good quality, you should go to a bigger city and get it done. Your requirement to stay in the city will be 4 to 6 weeks, not more than that.
There is another question, doctor. It's slightly sensitive. It's about money. Saying that hip replacements have become exceedingly expensive, especially in the hospitals of Mumbai and Delhi. It is advised that it's perhaps better to go down south and get the hip replacement done. Your comments. I know you are a doctor in Mumbai, so but still, since this is a question, I thought I'll ask you.
Sir, I have clarified that we have different components, okay? If I'm going to use stainless steel and I'm going to use only ordinary high density polyethylene, the cost will go down. Now, government had realized that there is a big gap between the real cost of the prosthesis. When we put a joint, it's known as prosthesis. Okay, you may call it implant, but the proper terminology is prosthesis. There is a ceiling on each and every prosthesis. Every prosthesis has been given a particular cost, so we cannot go beyond that. But in the city of Mumbai, everything is expensive. So if you cannot afford anything, I have done several surgeries coming from small towns referred by one particular minister, where including even prosthesis cost was borne by me or the hospital, absolutely free treatment. So don't be under that impression that if you come to Mumbai, you will be kind of ripped off. No. If patient is deserving, we are there, we are sympathetic. The hospitals also have a quota, which is a situation the medical social worker will find out. If you have an orange ration card, everything is given free to you. So don't be under that impression, including the implant, which may cost you to the tune of 1 lakh of rupees. Okay.
Thank you. We have a question from Anmol Jain, and this is perhaps the second last question we'll take. What is the normal success rate of the hip replacement procedure?
Done by a good surgeon in a good environment with a good understanding and all the possible biological situations kept in mind, should last for 20 to 25 years without any difficulty.
Right. And one last question from Mr. Santa Maria again. Is DEXA really reliable, or is there any other way of diagnosis?
To decide, actually, when you have fever, you put a thermometer and find out what is the temperature. Similarly, the rough marker is DEXA scan, which is like if there are floods in some part of India, then the minister goes into the helicopter and tries to find out where are the floods. Similarly, DEXA scan is a marker which gives you what is the level of your quality of the bone. But there are many other things which corroborate to this, like you want to find out what is the calcium level, what is the vitamin D level, what is a parathyroid level. All these levels put together will give you an indication. And how am I going to decide what line of treatment I want to give you? Unless you do a DEXA scan, whereby I'll tell you that from 0 to minus 2.5 is osteopenia, which can be treated, or if you are above 50 to 55, by bisphosphonates every day, or once in a week, or once in a month, or zoledronic acid once in a year. If it is worse than minus 2.5 or worse than minus 3 to be precise, I would use teriparatide injections every day for 2 years to improve the quality of the bone. Needless to say that your physical exercises are more important. Please keep in mind. And whatever is like a bank, if you have deposited money in your young age, so if you have deposited good bone in your young age, you will reap the harvest of that when you are old. But if you have not done any exercises, no physical activity, only a couch potato, then your quality of the bone will go down the drain and you will need all these medicines.
Right. Doctor, there's a interesting question that has come in. You mentioned about Marilyn Monroe and the fact that she had a problem with her hips. If she could continue to act, is it possible to work without a replacement? This
is a question which always crops up because Marilyn Monroe is such a celebrity. Look, she had dysplasia of the hip, not to the tune that it was going to be detrimental for her to do anything. In fact, those who have congenital dislocated hip, quite often they have excessive movements. But we had Chandrasekhar who had polio limb, and the way he could bowl well, people found that it was googly. So you may consider it to be a good asset, or you may call it as a handicap. When asset becomes a handicap is the time you need to do the surgery.
Great. Thank you very much, Dr. Shah, for the excellent presentation and for patiently responding to all the questions.
Well, there were a few more also. A few people had raised hands. You please do not kind of disappoint them. I am willing to answer because we still have 5 minutes, as you had told me. And if you want to stretch up to 6, I'm willing for that.
Yeah, no, they have not raised the questions. There was Mr. Jitendra Shah and Geeta Shah who
raised their hands but didn't ask any question.
And did not ask the questions. So
no problem.
Which is fine. Thank you very much. And but of course, Doctor, are you available for teleconsults and?
Definitely. I earlier actually from 1st April 2020 till June and did only teleconsultations.
So how does one do that?
We can do it on WhatsApp or on Skype or whatever the patient is familiar with. I think WhatsApp is very convenient to them.
Is there a number?
There are many platforms where they use my name, but you can contact me directly also.
All right. So
seniors today can give you my number, and if it's permitted, then I'll give my number. Otherwise, not.
Yeah, you could give it. You could give it very much because we always do that at the end. So shall I give you? Shall I give your the mobile number that we reach you at, or is there another number?
No, same. I do not hide. And email ID also, if they have questions without paying payment, they can ask me questions on that.
So the contact number for Dr. Dilip Shah is 982105048. What we will do is this, the edited video of this session will be there on Seniors Today website on Monday, along with the takeaways. The takeaways text, which will have Dr. Shah's phone number as well as email address, so you can reach him there. My suggestion is that you should WhatsApp him, and perhaps if he's free or whenever he's free, he will revert. Thank you very much, Dr. Shah, for this.
Just give me 1 minute.
Yeah.
I have in chat all panelists and attendees given my numbers. If you want to take a screenshot, you can take it, all of you.
That's right. That's right. So it is mentioned over here, Dr. Dilip D. Shah at gmail.com. And the mobile number I had mentioned, 98210-50480. So you could reach Dr. Shah at this number. You heard his explanation, always very lucid and detailed, and his examples are always good to hear and good to watch. Thank you very much, Dr. Shah, for this session, for taking out time from your busy schedule. It was an
I will coin a terminology for seniors today. Seniors today will be youth tomorrow, but day after they'll be the juvenile people, and after that they'll be neonates. So the more you grow, the more younger you become.
Thank you very much. We will be back once again next week, next Saturday at 5 p.m. And next Saturday, we have a session with Dr. Monica Das, who we've had in the past, and she has conducted our counseling workshops, and she has been doing these sessions on curating the WhatsApp group for people who had issues and concerns with the second wave. She will be there in the house next Saturday. So those of you who would like to attend the session, please register. The registration will be open from Monday onwards, and you could be there. Thank you once again, Dr. Shah, for gracing the Seniors Today Forum, and we'll see you again soon.
Thank you very much. It was my pleasure as much as yours for getting me on this platform. Thank you so much.
Thank you very much. Thank you.
Bye.